All right, it is time to talk about your insurance and your insurance deductibles and copays, and what does that mean? It is the beginning of the year, so I have spent an exhausted number of days trying to explain people's benefits to them. It is confusing. So, to no fault of their own, they are told they have chiropractic benefits or perhaps some other benefit, and then they get here and we have to actually explain to them how it works. So this is for you and anybody else you know who's confused by your chiropractic benefits or your benefits in general. So most insurances carry a deductible and then there's a copay. And what do those two things mean? So the deductible is the large amount of money that you owe in the beginning of the year before your benefits will kick in. Now that's for anything. The dentist, the chiropractor, your medical doctor, you have to be out of pocket that particular amount of money before your benefits will kick in. So let's just say, I'm gonna do a couple of examples here. Let's say you have a $200 deductible. Okay, that $200 deductible is represented by this basket. The basket needs to get filled first before your benefits kick in. And let's say after that $200 deductible, you have 80/20. So what that means is that your insurance company will cover 80% of your charges, and then you have to pay 20%. That 20% is your copay, all right? But first, you have to fill the basket. So this is $200. Now, let's say you come to the chiropractor and you have 12 visits. 12 visits is gonna, between x-rays and an exam and a couple of chiropractic adjustments, it's probably not gonna use all those 12 visits. So here's the caveat. So $200 deductible, and let's say this represents out of pocket a full office visit. So if I charge $80 a visit, just say, then you have to pay that $80 into the basket. Okay, so you're out of pocket. I bill it to the insurance company. They apply $80 towards your deductible. Okay, now we're starting to chip away at the deductible. So you have a $200 deductible. So here's next time you come in, there's that one. And then here's your third visit. Now you have 12 total. Well, here's the caveat. You have paid 100% for your visits. It goes towards your deductible, but now you're less 3 visits. This is what gets really confusing for people. The question becomes, why do they use my visits even though I'm still paying out of pocket? It just is what it is, okay? If you don't like it, then you gotta change your policy. So now we've got our 3 visits in, we've paid it 100%, and now you come in, I bill that, and now let's say your copay is $20. So instead of paying $80 out of pocket, it's $20, which now represents these little chocolates, okay? So now you've got 12 total, but we only have 9 more left, okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9, okay? Now we're done. You're out of benefits for the year. And then now you just go on to a cash pay. So now you're back out of pocket. All right. So that's the first scenario. We got to use some of your benefits, but you had to use 3 visits to do that. So the next scenario, and this is the one that really upsets my patients. And you know, I don't think they get upset at me, but they get upset and I feel badly. And I'm the one trying to explain it to them. And then they're saying, well, why does my insurance company do that? And why don't they do this? And I'm like, I can't answer that question. You have to call your insurance company and ask them. So the next scenario is we have a bigger bucket, okay? This bucket represents $3,000 in deductible. And so you've got to be out of pocket $3,000 before your benefits will kick in anywhere. Again, chiropractor, dentist, medical doctor, wherever you're going. So now you still only have 12 visits. Well, let's say 12 visits, we'll just give it a round number. 12 visits is $500 total, all right? So we take our 12 visits. Each time you come in, you have to pay your full visit fee. So let's say that's $80 again. 1, 2, 3, 4, 5, 6, 7, you're paying $80 every time you come in, and we're using a visit. You only have 12 of them, okay? And then here we go, 11, 12. But guess what? You still have to fill this bucket, okay? So you have $500 that we've filled into the bucket. Now you've used your 12 visits. You have no more. And you still have $2,500 left to put in this bucket before your benefits will kick in. This is where people get upset because they have to use the visit in order for it to go to your deductible. All right, so I hope that helps in the explanation. There is nothing I can do about it. I can't petition your insurance company. I can't complain to them. I can't bill visit 13 and have it get paid. It is not going to happen, all right? Now, the other thing too is, depending on the number of visits, 12 visits is not enough to correct your spinal imbalance. And if you saw my video that I did yesterday on orthodontics and spinal balance, you would know that correction is more than 12 visits, and it's more than a month. So that's the biggest thing, is when you come in and you've got 12 visits, that's like, it's a drop in the bucket, literally. It will not help to correct your spine. It will not create long-term health, and you will not get greater spinal stability and long-term health from that. So it's really critical to understand that, that's not enough to correct your spine, nor is it enough to help get you through and maintain your spinal health. Now, the other part of that is your insurance company doesn't pay for wellness. So let's say you go, okay, well, I'm just going to pay out of pocket, and when my deductible's met, then I'll use my benefits. Well, probably by that time you'll be on wellness, and we still can't use your benefits, okay? That's how it works. I'm just the messenger. So I would love your feedback on that. And again, I would love for you to please share this video because it's really critical that people understand their insurance benefits. Nobody understands their insurance benefits. And aside from that, I will have people come in and they will have like a $50 copay, which again, to me is insurance fraud, because why would you give somebody chiropractic benefits and then have them pay a $50 copay? It's just kind of ridiculous. But insurance is ridiculous. It's confusing. We have it for a reason. It is really great if you have a catastrophic event. If you have a $3,000 deductible and you have something catastrophic, a car accident, God forbid, or something that requires you go into the hospital, you have to really go, geez, thank God I'm only on the hook for $3,000. I mean, that's a big deal, right? So in a catastrophic event, when it could cost you hundreds of thousands of dollars or tens of thousands, you are only on the hook for $3,000. That's really, we have to think of our insurance more as a catastrophic piece of our lives. It is there for crisis care. It is not there to help you get well and stay well, okay? All right, please share this video, and I hope I cleared up some information regarding insurance benefits.